something extraordinary happened in modern medicine. Not inside laboratories or universities or government hearings, but online, across YouTube, Reddit, Facebook groups, podcasts, encrypted chats, and independent forums, a rebellion began. Not a political rebellion, nor a military rebellion, but a medical rebellion. Cancer patients, families, survivors, alternative health advocates, and independent researchers, all united by one terrifying belief: that the medical establishment was either ignoring, minimizing, or suppressing treatments they believed deserved serious attention. At the center of that rebellion stood an unlikely symbol: Mebendazole, a cheap veterinary deworming drug, a medication never designed for human cancer treatment, and yet millions began discussing it as if it represented something far larger than medicine. To supporters, Mebendazole became a symbol of resistance. Resistance against pharmaceutical power, institutional control, and healthcare system many no longer trusted. To critics, it became something else entirely: a dangerous internet-fueled movement built on anecdotal hope, scientific misunderstanding, and medical misinformation. And somewhere between those two worlds, real patients were fighting for survival. Today, we enter the center of the Mebendazole rebellion, a story about cancer, desperation, distrust, the internet, and the growing war between ordinary citizens and the institutions meant to protect them. To understand the Mebendazole rebellion, you first have to understand why millions of Americans increasingly distrust the medical system itself. For decades, faith in institutional authority has eroded. Government agencies, corporations, media organizations, universities, public health systems, and medicine was not immune. The opioid epidemic became one of the defining healthcare scandals in American history. Powerful pharmaceutical companies aggressively marketed addictive drugs. Doctors prescribed them widely, and regulators faced criticism. Millions souffraient. Then came rising drug prices and stories of bankrupt families, insurance battles, hospital costs, and denied treatments. To many citizens, healthcare increasingly looked less like healing and more like an industry tied to profit. This perception became fertile ground for alternative narratives because once trust weakens, suspicion grows rapidly, and when people are diagnosed with cancer, one of humanity's most feared diseases, that distrust intensifies dramatically. Cancer patients often feel trapped inside systems they cannot fully control. Appointments, protocols, insurance approvals, waiting periods, statistics, side effects, and their survival suddenly depends on institutions. When fear meets distrust, rebellions begin. Mebendazole existed quietly for decades, a veterinary anti-parasitic medication used for worms and animals. It's cheap, generic, and unremarkable. Then came the stories. Patients claiming unexpected recoveries, people sharing scans, families posting emotional testimonials. And one name became central to the movement: Joe Tippins. His public story spread rapidly online. A man diagnosed with advanced cancer, who later claimed remarkable improvement after using a protocol involving Mebendazole alongside other supplements. Whether coincidence, biology, treatment interactions, or something else entirely, the emotional impact was explosive because to millions of desperate people, it sounded like the story modern healthcare never wanted them to hear: a cheap drug, no billion-dollar branding, no exclusive patents, and no massive pharmaceutical campaign. Just an ordinary substance that supposedly changed lives. The internet did the rest. Algorithms amplified hope, and soon, Mebendazole was no longer just a drug. It became a movement. Cancer changes human psychology. Few experiences are more emotionally destabilizing than hearing the words, "You have cancer." Suddenly, mortality becomes personal, immediate, and terrifying. People who once trusted systems completely may begin questioning everything. Every treatment, recommendation, side effect, and statistic. When conventional treatment fails, fear transforms into desperation. This is where alternative movements gain enormous power, because desperation searches relentlessly for possibility. Hope becomes psychologically irresistible, especially when mainstream medicine offers uncertainty and oncology is filled with uncertainty. Some treatments work brilliantly while others fail. Some patients respond unexpectedly while others decline despite aggressive intervention. Cancer biology is extraordinarily complex, but emotionally, many patients do not experience medicine as complexity. They experience it as survival. That emotional reality fueled the Mebendazole rebellion more than science ever could, because millions of people were not searching for perfect evidence. They were searching for hope. Before the internet, patients relied heavily on doctors for medical information. Today, everything has changed. Now anyone can access scientific studies, alternative opinions, patient testimonials, independent researchers, podcast interviews, health influencers, and medical forums. This created a completely new type of patient, a self-directed patient. Someone who researches aggressively, questions authority, compares opinions, and builds their own conclusions. Sometimes this leads to empowerment, and sometimes it leads to confusion, and sometimes it creates direct conflict with medical professionals because doctors are trained within evidence-based frameworks. Patients online are often driven by emotional narratives. Those two worlds increasingly collide. The Mebendazole rebellion became one of the clearest examples of that collision. Patients accused institutions of arrogance, while institutions accused internet movements of misinformation, and between them stood a terrifying reality. People were dying. Contrary to popular internet claims, scientists did not completely ignore Mebendazole. Researchers had already studied compounds related to Mebendazole for years. Mebendazole belongs to the benzimidazole family. These compounds affect microtubules, structural systems essential for cellular processes. Cancer cells depend heavily on cellular division. This overlap attracted scientific curiosity because some preclinical studies suggested possible anti-cancer effects in laboratory settings. Researchers observed potential disruption of tumor cell pathways, possible interference with glucose metabolism, stress on cancer cell survival mechanisms, but this is where the internet often oversimplified the story. Laboratory evidence is not the same thing as proven human therapy, as thousands of compounds kill cancer cells in petri dishes, but most never become successful treatments. Why? Because the human body is infinitely more complicated. Compounds that appear promising in isolated conditions may fail inside real biological systems. Some cannot reach tumors effectively, while others become toxic and others stop working entirely. This gap between early scientific possibility and proven clinical treatment is one of the hardest concepts for the public to understand, especially online, because online culture rewards certainty while science rewards skepticism. At the center of the Mebendazole rebellion lies one enormous philosophical conflict. What counts as evidence? For many patients, lived experience feels undeniable. If someone takes a substance and later improves, that experience becomes emotionally convincing, and emotionally, that makes sense, but science demands something stricter because human biology is messy. Patients often use multiple therapies simultaneously. Tumors behave unpredictably. Spontaneous remissions occasionally occur. Different cancers respond differently. Anecdotes can inspire investigation, but they cannot alone establish causation. This distinction became the central battlefield. Supporters said, "Why won't they investigate more aggressively?" Critics responded, "Investigation is not proof." The internet often treated caution as corruption, but medical professionals viewed caution as responsibility, and both sides increasingly stopped trusting each other. One of the most powerful drivers of the Mebendazole rebellion was economics. Cancer treatment is a massive global industry, and advanced oncology drugs can cost staggering amounts. Targeted therapies, immunotherapies, precision medicine, and biologic treatments. Some have produced extraordinary medical breakthroughs, but they're also immensely profitable. To critics, this created a disturbing possibility. What if cheap treatments receive less attention because they generate less financial return? It is an emotionally compelling argument, And it resonates because history contains real examples of corporate misconduct. Yet reality remains complicated. Drug development itself is incredibly expensive. Clinical trials require enormous funding. Safety monitoring is extensive and regulatory approval is difficult. Companies naturally prioritize financially viable investments. This does not automatically prove suppression, but it does create structural incentives, and those incentives became central to public suspicion. The Mebendazole rebellion was never only about one drug. It was about a deeper fear that medicine itself had become too connected to profit. No institution became more controversial in the Mebendazole debate than the U.S. Food and Drug Administration. To supporters of the movement, the FDA represented gatekeeping, a slow-moving bureaucracy allegedly resistant to unconventional ideas. To defenders of the FDA, the agency represented necessary protection because history contains countless examples of dangerous miracle cures, fraudulent treatments, unsafe compounds, and medical disasters. Modern regulation emerged partly to prevent those tragedies. The FDA's position remained straightforward. Mebendazole lacked sufficient large-scale human clinical evidence proving safety and efficacy for cancer treatment. But emotionally, many patients heard something else. "We are ignoring your hope." This emotional interpretation intensified the conflict because cancer patients often do not experience regulation abstractly. They experience it personally, as time. And for someone facing mortality, time becomes everything. The internet transformed the Mebendazole discussion into a full-scale cultural phenomenon. Influencers built massive audiences discussing alternative cancer protocols. Podcasters framed the debate as a battle between ordinary people and powerful institutions. Comment sections became war zones. One side accused mainstream medicine of arrogance and corruption, while the other accused alternative movements of spreading dangerous misinformation. Algorithms amplified conflict because outrage drives engagement, fear drives clicks, hope drives shares. Soon, Mebendazole content reached millions, and many viewers no longer saw the issue as a scientific debate. They saw it as a moral struggle. Patients versus corporations, citizens versus institutions, and hope versus control. This emotional framing made the movement incredibly powerful because rebellion itself became part of the appeal. But the rebellion contained its own contradictions. Many people distrusted pharmaceutical profits. Yet alternative health ecosystems also became highly monetized. Influencers sold supplements, courses, membership groups, consultations, and exclusive protocols. Fear became business. Hope became business, and distrust became business. Here the story became morally complicated because not every critic of mainstream medicine was necessarily acting altruistically. Some genuinely believed they were helping patients. Others recognized the enormous financial power of anti-establishment audiences. This complicated the narrative dramatically. The conflict was no longer simply patients versus corporations. Now multiple industries competed for trust. Traditional healthcare, alternative medicine, social media personalities, and supplement brands. Everyone claimed to possess truth, and patients were left trying to decide whom to believe. Many oncologists reacted strongly against Mebendazole claims, not necessarily because they opposed research, but because they feared something extremely dangerous: patients abandoning evidence-based treatment. Cancer treatment decisions can determine survival, and doctors carry enormous ethical responsibility. They cannot recommend therapies based solely on viral enthusiasm. They require controlled evidence, reproducible outcomes, risk analysis, and long-term data. Until those standards exist, most physicians remain cautious. Yet online, caution often looked like hostility. When doctors warned patients against unsupported claims, some patients interpreted it as dismissal, arrogance, and institutional defensiveness. The communication gap widened, and eventually, some patients stopped trusting oncologists entirely. This may be one of the most important parts of the entire story, because once trust between doctor and patient collapses, medicine itself becomes fractured. Many cancer patients describe feeling emotionally isolated inside modern healthcare systems. Appointments can feel rushed, statistics can feel cold, and protocols can feel mechanical. Patients often want more than treatment. They want certainty, empathy, possibility, and hope. When medicine cannot provide certainty, people naturally search elsewhere. The Mebendazole rebellion gave many patients something emotionally powerful, a sense of agency. Instead of passively receiving treatment, they felt actively involved in fighting for survival. This psychological empowerment should not be underestimated, even when science remains uncertain, because human beings do not survive emotionally on data alone. They survive on meaning. The Mebendazole rebellion revealed a growing divide in modern society, two completely different ways of understanding truth. The first worldview, evidence-based institutional medicine built on clinical trials, peer review, statistical analysis, regulatory oversight, and scientific skepticism. The second worldview, populist, decentralized medicine built on personal testimony, community experience, distrust of centralized authority, independent research, and internet-driven collaboration. Both systems contain strengths. Both contain weaknesses. Institutional medicine can become bureaucratic, slow, impersonal, and influenced by financial structures. Populist medical movements can become emotionally reactive, overconfident, scientifically inconsistent, and vulnerable to misinformation. The danger emerges when either side claims absolute certainty, because medicine itself is filled with uncertainty, and cancer is one of the most uncertain fields of all. So where does the evidence stand? The honest answer is uncomfortable for everyone. There is scientific interest in drug repurposing, and there are legitimate reasons researchers study compounds like Mebendazole. There are anecdotal reports from patients who believe it helped them, and there are also major gaps in rigorous human clinical evidence. At present, Mebendazole is not established as a proven human cancer treatment. That does not automatically mean it has zero potential, but it also does not justify declaring it a hidden cure. The truth exists inside uncertainty, and uncertainty is emotionally difficult, especially for patients fighting for their lives. Perhaps the greatest danger in modern healthcare is not skepticism, it is false certainty. History is filled with treatments once celebrated as breakthroughs, but later proven ineffective or harmful. But history also contains examples of ideas initially dismissed but later validated. This tension is exactly why rigorous science exists, not to destroy hope, but to separate possibility from illusion. The problem is that rigorous science moves slowly while the internet moves instantly, and emotionally compelling stories spread far faster than cautious evidence. This imbalance defines the modern information age. The Mebendazole rebellion was never simply about a veterinary drug. It was about trust in medicine, in institutions, in expertise, and in systems people increasingly feel disconnected from. Millions of citizens now question whether modern healthcare truly serves patients first, and whether justified or not. That perception is reshaping medicine itself. The internet has permanently changed the relationship between patients and authority. People no longer accept expertise automatically. They investigate, challenge, debate, and resist. Sometimes wisely, sometimes dangerously. But the era of unquestioned institutional trust is fading, and the Mebendazole movement became one of the clearest examples of that transformation. Not because everyone believed the same thing, but because millions shared the same fear that somewhere inside modern medicine, ordinary people had lost control over their own survival. Maybe Mebendazole will eventually prove valuable in ways science does not yet fully understand. Maybe future research will uncover important discoveries, or maybe the movement will become another chapter in the long history of medical controversies driven more by hope than evidence. Right now, nobody truly knows, but one reality is undeniable. The rebellion exposed a profound fracture in modern healthcare. A fracture built from fear, distrust, economic pressure and information overload, and humanity's desperate search for control against one of its oldest enemies, cancer. Until medicine can fully answer that fear, movements like this will continue to rise. This documentary is for educational and informational purposes only. It does not provide medical advice, diagnosis, or treatment recommendations. Mebendazole is not approved by the U.S. Food and Drug Administration as a cancer treatment for humans. Patients should consult qualified medical professionals before making healthcare decisions.